I'm Dr. Manuel Astruc. I'm a board-certified psychiatrist. I help entrepreneurs who are suffering from depression get back to being energetic, productive, and very confident. Everyone is having mood swings these days. Have you noticed that? Like, everyone has mood swings, and the diagnosis of bipolar disorder is just being thrown around all over the place. But what is a mood swing, and what actually is bipolar disorder? And more importantly, like, why is this important? From my perspective, here's the reality. It takes up to 7 years from when someone enters treatment for a mental health issue, anxiety or depression, on average, 7 years until an accurate diagnosis of bipolar disorder is made. And this is in spite of the fact that we've been preaching and talking and teaching primary care doctors, psychiatrists, pediatricians, OBGYN, like what is bipolar disorder and how to recognize it. So it is hard to find the diagnosis when someone presents with depression or anxiety. And it becomes incredibly important for treatment that we're accurately diagnosing as quickly as possible what is really bipolar disorder instead of depression, anxiety, or like everyday sorts of mood swings. Here's a story that I've heard over and over and over again. So a patient will show up and they'll be telling me about the fact that they've been depressed, been treated for depression, they've been on multiple medications for depression. And when I get a history and I go back over time, I do a timeline to childhood and high school and college, I'll get a history that, in college and in high school, what they found was that they would get lazy in terms of doing their work. They would procrastinate, they wouldn't be able to do their homework, they would be missing classes, but they would suddenly get a burst of enthusiasm and energy and like crack down and catch up, and then they'd lose their motivation and interest again. But they knew that at some point they were going to get their burst of energy and they were going to get the work done. And this is how they've operated for years and years. Periods of times where they just can't get themselves to do what they need to be doing, and then a surge of energy where they suddenly catch up. And now the depression has just been unremitting, right? They're waiting for that burst, and it just has not happened in spite of like a lot of antidepressants. And for this individual, it's not unusual that they will tell me antidepressants can make things worse, or antidepressants start working and then stop working, or they're on their antidepressants, their anxiety is getting way worse, and they're getting a lot of insomnia. So a lot of side effects for the medications that they're treating. And the clue to me with all of this, kind of putting it together, is that someone has bipolar disorder, and that we need to start talking about a different sort of treatment, because the antidepressants will not help someone who's really got bipolar disorder in the long run. So what is bipolar disorder? Bipolar disorder is one of the two mood disorders that we have. So there's unipolar depression, and we said that affects about 20% of the population at any given time in their life. In your life, you've got a 1 in 5 chance of having a clinical depression. Bipolar disorder is the second mood disorder, and what's different about bipolar disorder is that it's cyclical. It tends to cycle. It comes and goes. And the cycles will often have high highs that cause problems, or low lows, depression, that cause problems. Typical story. Someone I saw earlier today gives a history of being down in the dumps, hard to do things. She was having a hard time getting herself to go to work. She would be missing classes when she was in school. And then suddenly, after days or weeks like that, she would get a burst of energy. She suddenly would not need very much sleep. She would talk a lot. she'd get very creative. She says, I'm not a baker, but suddenly I find myself baking, right? She says, all of a sudden, she goes online, she looks at a pocketbook that she would never buy because it's, $1,000. She buys a pocketbook that she would never buy. And then someone turns off the lights and she's back to being depressed, right? And her big concern when she talks to people, when she goes to her doctor, is not, I have these periods where, I get a lot done and I bake. Her concern is when she can't go to school. Her concern is when she can't get to work. She shows up saying she's actually depressed. And if someone's not looking carefully for the mood swing, right, the bipolar cyclical quality, it's incredibly easy to miss. Now, there's two big buckets of bipolar disorder. There's what we call bipolar type 1 and bipolar type 2. And they're so different that in some ways I wish they didn't have names that were that close together. So bipolar 1 is diagnosed on the basis of having had one manic episode. So one manic episode will qualify you for a diagnosis of bipolar 1. And there's often going to be cycles then of ups, so more than one is usually what will happen with bipolar disorder. So we give a diagnosis because it gives us a prognosis. If you've had one manic episode, the chances are that you're going to have more manic episodes and that there's going to be depression in there as well. And oftentimes with bipolar disorder, the part of the illness that causes the most problems, the most distress, is really the depressed part. Not always, right? But we think of bipolar disorder as an iceberg. The part that you can see and the part that causes a lot of problems is oftentimes the mania, but the depression underneath is like the iceberg. It's 2/3 of the iceberg. Under the water, you don't see it, but that's oftentimes where a lot of the pain and the suffering, the functional impact, and the significant amount of distress for the individual is. So that's bipolar type 1. Bipolar type 2, you have hypomania, Hypo mania, which means a small mania. Small mania where the ups do not cause problems. Now, if I brought 100 people into the room and I asked them, are there periods of times that you feel significantly better than other times? Like 100% of them are going to say yes. But there's specific things that we're looking for in mania other than just feeling good. But with bipolar 2, what we're really looking at, the bulk of the illness is not really the hypomania, the low-grade ups. It's really the fact that there's a very regular and cyclical series of depressions. So people show up with a history of recurrent major depressions with periods where they're fine, and often this history of I have failed to respond well to the antidepressants. They don't work for me, they work for a little while, they stop working, they make things worse. So bipolar type 2, it's important to be looking for because it takes 7 years to get to the final diagnosis if we're not careful, and the sorts of medications that we use, which are the mood stabilizers, we can't use them if we're not thinking about the right diagnosis. So how do we diagnose a manic episode? Mania is defined by having a period of time that's at least 1 week long in which people have a persistently elevated or irritable mood and a lot more energy and are doing a lot more stuff. And then we talk about them having 3 of the following 7 symptoms. And if the predominant mood that someone's having is not this, up elevated mood, but more of the angry, irritable mood, then we need 4 of the following 7 symptoms. And the symptoms are grandiosity, like a sense of self-esteem that's like off the hook. Increased need for talking. People get incredibly talkative. A decreased need for sleep without really showing the effects of that the next day. So people will start sleeping 4 hours, 3 hours, 2 hours, and just continue to be an Energizer bunny and just be incredibly full of energy in spite of that. Racing thoughts. So people will describe this racing in their head. And oftentimes you'll see that with just their thoughts are a mile a minute as they're talking fast. People get incredibly distractible. There's an increase in goal-directed activities. So people are just a lot busier doing a bunch of stuff. And sometimes it can be to the point where it's stuff that doesn't make any sense to be doing. And sometimes it's organized and productive. And then lastly, there's an increase in impulsive and potentially dangerous behaviors. So this is where we see people spending a bunch of money. There can be sexual indiscretions with being involved with people you normally would not be involved with, or you're married and you're having affairs, gambling, drinking, but behaviors that are not typical for an individual. All of a sudden, someone is very involved in risk-taking behaviors. So when someone is suspected of having bipolar disorder, or you're not responding to antidepressant treatment, I think that this is a call to action for yourself, a loved one, a friend, because this is where getting an evaluation by an expert. So in my private practice, myself, the nurse practitioners that work there, we're all experts at diagnosing, treating, and managing bipolar disorder, which is a hard illness to treat. And my opinion is that by and large, individuals with bipolar disorder are best managed with a specialist rather than an internal medicine doctor or a family practitioner.